Keith Burr with Amwins. Today I want to talk to you advisors. The advisors with plans with anywhere from 100 to 5,000 employees. And I want to talk to you about some strategies and tactics that center around cost containment, risk mitigation, and your fiduciary responsibilities. And the question when I come through some of these strategies and tactics is ask yourself, are they worth doing? Do they provide the proper procedures and proper controls for the plan that makes sense for them? And is there a return on investment when following through on these strategies? Start out with the data. That's the central focus of all of this, is getting the data on a consistent basis, usually monthly. We're finding that 80% of the plans out there in the 100 to 5,000 aren't getting this data. And the reason we stratify that to 100 to 5,000 is most of the big plans are doing this. They're well scrutinized and well taken care of and have a team of people. We're finding in the smaller plans aren't getting that scrutinization that they need to have. So within that, we look at monthly billing and claims. Just a very simple thing. Are those monthly bills being matched up to what the claim is? Are they being paid properly and according to the plan? Again, we're finding about 80% of the firms out there aren't doing that. Whether they don't have the resources or the capabilities on it, it's just not getting done. So that's a possible area where dollars are leaking through the plan. In our experience when doing this, we do find that there are dollars there. Are you overpaying for some of these bills that are coming in? And the answer is usually yes in some cases. Dependence on the plan. We find anywhere from 3 to 6% of dependents that are on the plan don't meet the summary plan description eligibility rules and should be removed. So when you're looking at on a cost basis, each one of those dependents is worth anywhere from $4,000 to $4,500. That's the normal range within that. So removing them could have an instant savings for your plan. Also, as far as a fiduciary responsibility, every plan that's under ERISA has a fiduciary responsibility not to have people on the plan that shouldn't be there. Risk mitigation, there's a tremendous amount of risk out there. It doesn't happen all that often, but it's still a big risk in that those dependents that are on the plan, if they're not removed and that claim that they're on goes over stop loss will not reimburse for that. So the plan will be subject to that. And we have cases out there of multi-million dollars that were hitting the bottom line of the plan because they were never eligible to the plan and they were never policed properly. You've got high cost RX and high cost regular claims. So those RX claims are coming in, as you know, with the ACA caps removed, those old $2 million claims are now growing into multi-million dollar claims. So you look at that, you've got specialty drugs. So you want to be able to look at and have clinical reviews to see other savings that would apply, other alternative therapies that could have. What are the future estimated annual therapy costs for those? Those would be important numbers to want to know. Expected treatment options and durations, and again, alternative therapies, both for the claims and for the pharmaceuticals, because are there other pharmaceuticals that would be less costly and still do the same thing? So when we manage those, there's a big return on investments, and those few large claims can drive the whole cost of the plan into the future. So that's one area we want to talk about. Just normal claims and pharmaceutical reviewing. Okay, are you doing that on an annual basis or every 3 years? What would we know if we looked at 100% of your claims every year? Are there patterns there? Are the claims being paid according to the plan? Are there things like duplications, whether they're clinical or mechanical, overpayment of assistant surgeons, or just to name a few little areas there? And the same with the reviewing of the pharmaceuticals, procurement and administration contract review. How often have they reviewed those contracts? What's in those contracts? You've got to look at the PBMs, you've got to look at pricing, dispensing fees. We've got ballooning RX costs that are going on, maximum daily dosages and things like that are out there that all need to be looked at. So as encompassing, you got several different strategies and tactics within that. So that's really what I want to share with you, and thank you so much.